Postpartum depression and anxiety are more common than many realize. Today we have Juliet Wangui, a psychologist, to discuss this and other common struggles that mothers face. We will discuss treatment options and how to spot the signs in yourself or your loved ones.
My name is Juliet Wangui, and I'm a psychologist by profession. I have been doing this profession for about 2 years, and previously I was working with the Dreams Girl, which is under World Health Organization, and currently I am working with inmates from Langata Maximum Prison. Okay, postpartum depression is a mental condition that affects especially women after giving birth, new mothers after giving birth, and it is not a weakness. It is just a condition whereby it goes beyond 2 weeks, and it can cause damage. Like, it can cause the mother and the child will lose ile bond. So ikionekana may go beyond 2 weeks, therefore there is a.
Juliet further explains that there are 3 types of postpartum depression, which are postpartum psychosis, perinatal, and post-depression anxiety. Postpartum psychosis involves a significant loss of touch with reality. Its symptoms appear suddenly, usually within the first 2 weeks after childbirth.
There are different types of postpartum depression, and there is this postpartum depression which everyone knows. There is postpartum psychosis, there is peripartum, there is also post depression anxiety. You see, so there are many. The first one, which everyone knows, postpartum depression, is whereby it's a mood disorder, whereby the woman, the new mother, not the woman, the new mother feels like she's not capable of taking care of the kid, and feels, at the moment he feels overwhelmed. He feels and it affects the relationship between the child and the mother. The postpartum anxiety is whereby you feel overwhelmed being a new mother. You feel like, I cannot be a good mother. I can't. Even you cannot sleep. Those people who they undergo this as postpartum anxiety, most of them, they even cannot sleep. They feel like, if I sleep, my child maybe anaweza anguka, anaweza kosa kupumua. They have that kind of fear surrounding their newborn. The other one is peripartum depression. This is where that depression starts immediately when the mother comes to know that she will be expecting a child, and maybe she wasn't ready to carry another child or to have a child at that moment. So you find this woman, during those 9 months, she will be facing kind of stress, which is called peripartum depression. And postpartum psychosis is whereby that woman will start hallucinating. You see, when she gives birth, after giving birth, she starts hallucinating things which are not there. Maybe she feels like, maybe it's real,
For too long, the narrative around postpartum depression has focused solely on the mother, but the experience impacts the entire family. Men often find themselves navigating through it, though they fully do not understand these challenges. For partners, educating themselves about the symptoms is vital in recognizing when their loved ones needs help.
So also men, they also undergo postpartum depression. Yeah, they also feel overwhelmed, especially new fathers, and maybe they are struggling financially. You find most of them, they will be affected on how they are going to deal with the new kid or the new member of the family. Also, for the two parents to come together is for them to support each other, because if they don't support each other, one will feel like all the burden ni amepewa bebe. But when we help each other with some advice, with some counseling, with being there and affirming this person, I will stand with you, it's going to make the situation more lighter.
Single mothers overcome postpartum depression by building a strong support system through family, friends, and support groups, by reaching out and asking for help, allowing friends to assist with child care, household chores, and providing emotional support.
Now, in the case of the single mothers, I can say that maybe the family, the closest family, that is the mother, the brothers of this young lady, should be able to be part and parcel of her journey to motherhood. Because if she lacks that support, she may feel like everything is against her, the world is against her, and she may feel like I cannot go beyond this, And also the doctors, the nurses who are handling her should be very sensitive with her, because she doesn't hope to get any support from any person, but even from the close people who are working with her in the hospital.
The arrival of a newborn is often portrayed as a time of pure joy. But for many mothers, the reality is far more complex. The baby blues are common, but when those feelings deepen, linger, and intensify, it can signal something far more serious: postpartum depression. Recognizing these symptoms is the first step. But what can be done? Juliet emphasizes that help is available. By breaking the stigma and providing access to effective treatment, we can ensure that every mother has the opportunity to experience the joy of motherhood, free from the shadows of postpartum depression.
I can tell them if they feel overwhelmed with what they are going through, and maybe they feel that they don't have that resource of getting a counselor by themselves. There's so many ways you can get counseled. You can even join a support group whereby you will meet other mothers who maybe in the process they will share their stories, and maybe they will relate with yours, and maybe there is another woman who is much experienced will tell you on how you can handle such a case. And support groups are, are at a fair price. And also you can even get those support groups via internet, where you can speak your mind, other people they speak their mind, and you out of that conversation you can learn something new, and you can be able to incorporate it in your life, in your life and in the process you are undergoing. So I can tell young women that there is no excuse of not getting any information, as we are living in a world where if information is available to every person who will search for it. So please, if you feel like it is hard for you to get a counselor by yourself, which is very expensive, therefore there is another alternative, that is support groups, and also group counseling, whereby you book a counselor or two or one, and you settle down and you talk about your issue, and the counselor will be able to maybe give you more updates on what you are going through.
Maternal health did not just start yesterday. It began all the way from independence, with Jomo Kenyatta's era, to Moi, to Kibaki, to Uhuru, and now President Ruto. Gradual but effective changes have been evident since then. During the early presidency of Jomo Kenyatta and Daniel Arap Moi, maternal health care faced significant limitations. Access to quality health care, particularly in the rural areas, was restricted. Factors like poverty, inadequate infrastructure, and limited healthcare personnel contributed to high maternal mortality rates. President Mwai Kibaki's tenure saw crucial reforms that positively impacted maternal health. Key initiatives included increased focus on healthcare infrastructure, policies aimed at reducing financial barriers to healthcare access, such as the abolition of some user fees, the beginning of movements that would lead to free maternity care. These efforts contributed to improvements in maternal health service utilization. President Uhuru Kenyatta's administration prioritized maternal health through initiatives like the Linda Mama program, which provided free maternity services, increased focus on improving access to antenatal and postnatal care. These policies led to a notable increase in facility-based deliveries and improved maternal health outcomes.
My government has now made adequate budgetary arrangements to enable all pregnant mothers to access free maternal services in all public health facilities with effect from 1st June 2013.
President Ruto's administration has continued to address maternal health with ongoing efforts to strengthen healthcare systems, improve access to quality maternal healthcare services. There is continued focus on the universal healthcare coverage, which directly impacts maternal health. It is important to understand that the current administration is still in its early stages, and the full scope of its impact is still developing.
Tumesema ya kwamba tukienda mbele katika Taifa Care ambayo tumepangia vizuri, tuko na sheria ya kutosha, tuko na mpango ya kutosha, na tutabadilisha Kenya hii kwa mapenzi ya Mungu mpaka kila mtu aende hospitali atibiwe, aende nyumbani bila ya kuulizwa pesa yoyote. That is our commitment and that is our plan, and we will deliver on it.
Governments create and implement policies to ensure access to quality maternal health care. Policies related to antenatal care, safe delivery, and postnatal care. For example, the former Linda Mama program to remove financial barriers in accessing maternal health care and now through the SHA framework.
It is also good to say that under the Linda Mama maternity program, the numbers have increased to 638,541, ladies and gentlemen, accounting to 30% increase. This further underscores our commitment for reproductive and maternal health.
The funds have been allocated by the government to support maternal health services, including infrastructure development, equipment procurement, and staff training. This also includes funding programs that help with the distribution of essential medical supplies to hospitals and clinics. Investments have been channeled in building and maintaining healthcare facilities, particularly in rural and underserved areas, to improve access to maternal healthcare services. This involves ensuring that facilities are equipped with the necessary resources and staffed by qualified healthcare professionals.
Kila kijiji iwe na community health promoter. Nyinyi mnaona hawa watu wako na blue hapa? Hawa watu 2,000 tumekubaliana na Kang'ata huyu. Kila kijiji tuwe na muuguzi. Na hawa tumewapatia equipment ya kupima. Zamani walikuwa hawalipwi kitu chochote, siku hizi tunawapatia kitu kidogo. Na tunataka kuwapanga vizuri. Ndio tuhakikisha kwamba mambo ya afya inaanza kwa kijiji. Wamama, mimi nataka mnisikize vizuri. Kwa sababu tunataka kupanga mambo ya wamama hasa katika ile program ya Linda Mama. Mimi nataka niwahakikishie, Linda Mama tumeipanua sasa. Badala ya wewe kwenda hospitali mara 6, tumesema uende mara 10 bila ya kuulizwa pesa.
Governments monitor and evaluate the effectiveness of maternal health, and it involves collecting data on maternal mortality rates and access to healthcare services. Government's input is crucial for reducing maternal mortality and providing the health of mothers and their children.
Our maternal mortality remains high at 342 deaths per 100,000 live births, and this is an area where improvement is urgently needed, and today's flag off will support efforts to improve maternal health outcomes by ensuring access to life-saving interventions and medicines for mothers and children.
With the eradication of National Health Insurance Fund, the Kenyan government replaced it with the Social Health Authority, and many Kenyans are wondering what is the distinction. NIF previously implemented the Linda Mama program, which funded antenatal, delivery, and postnatal care services. SHA seeks to ensure universal coverage for all deliveries, with a focus on identifying and supporting vulnerable expectant mothers. The new system through SHA has increased tariffs paid to hospitals for maternal care when compared to the amounts paid under Linda Mama. You could be wondering, what is Linda Mama? It is a Kenyan government-funded, free maternity program managed by the National Hospital Insurance Fund, providing free maternity services to expectant mothers and their newborns, aiming to reduce maternal and neonatal mortality rates.
We recognize that only a multi-sectoral approach, including healthcare, education, and community support, can accelerate mortality reduction. Towards this end, it is therefore essential to increase investment, enhance collaboration, and focus on primary healthcare to scale up key interventions like skilled birth attendants, vaccinations, and improved nutrition. Recognizing that only urgent collective action can save millions of lives by 2030, we have pledged to enhance partnerships and establish a dedicated fund for maternal and child health.
While both NIF and SHA offer maternal care, SHA aims to provide more comprehensive coverage and accessibility, including services like antenatal, delivery, and postnatal care, with specific tariffs for normal and cesarean section deliveries. The Linda Mama program was a significant step in improving maternal health access. SHA builds upon Linda Mama, aiming for more comprehensive coverage and financial protection. SHA aims to standardize and improve the quality of maternal care across health facilities. The reimbursements to healthcare facilities for maternal care has been increased under the SHA system when compared to Linda Mama program. This is done to improve the quality of care that is given. SHA aims to reduce the out-of-pocket expense that women incur when seeking maternal health services. The journey of maternal care doesn't end with childbirth. It continues through the fourth trimester and beyond, as mothers navigate the challenges and joys of parenthood. By providing the right support, we can ensure that every mother and baby has the opportunity to thrive. This is the story of maternal care, a journey of life, love, and resilience. My name is Claire Anyango.